There is a window of time, roughly 25 seconds, that opens every single morning for adults over 60. It is not about what you eat for breakfast. It is not about whether you take a walk or skip one. It is not about your cholesterol numbers or the prescription bottles lined up on your bathroom counter. It is about something that happens in the very first half minute after your eyes open. A sequence of movements so embedded into daily habit, so completely automatic and unremarkable, that virtually no one has ever stopped to question whether it might be quietly working against them. And your doctor almost certainly has never raised it. That is not a criticism of physicians. They're trained to assess the standard markers. They look at your lipid panel, your fasting glucose, your resting blood pressure taken in a quiet examination room. They're not trained to ask what your cardiovascular system is doing in the 25 seconds after your body shifts from sleeping to waking. But cardiologists who study the timing of cardiac events, not just the cause but the precise when, have been pointing at this same narrow window for decades. The number that originally made me stop and look more carefully at this was a threefold difference. Fatal cardiac events are 3 times more likely to occur in the first 3 hours after waking than at any other equivalent period during the day. Not slightly elevated, not marginally higher. 3 times. That figure has been examined, replicated, and confirmed across decades of cardiovascular literature. And it exists for reasons that are completely specific, completely explainable, and to a meaningful degree, completely manageable once you understand what is actually happening inside your body during those first moments of the day. I want to walk you through that biology carefully because this is not a vague warning. This is a precise chain of events. And once you understand it, you will never step out of bed the same way again. More importantly, at the end, I'm going to give you a 4-step morning sequence that takes under 2 minutes, costs absolutely nothing, and works directly with your body's own physiology to reduce the pressure on your heart during this critical window. To understand the risk, you first have to understand what your body is doing while you sleep. Most people picture sleep as a uniform state of rest. Eyes close, the body powers down, morning arrives. The reality is far more dynamic than that, and the transition out of sleep is where everything relevant to this conversation begins to take shape. During the deepest phases of sleep, your body runs in something close to an ideal maintenance state. Heart rate is slow and even. Blood pressure settles to its lowest point of the entire day, sometimes 10 to 20 points below your typical waking reading. The hormones associated with stress are suppressed. Your blood vessels are relaxed and open. Your heart, which never stops, which never get a true day off, is operating at its gentlest load. But as your body prepares to wake, that maintenance state begins to shift. Your internal clock, governed by what scientists call circadian biology, begins preparing your system for the demands of being upright and alert. Cortisol, your primary stress and activation hormone, begins its pre-dawn rise while you are still asleep. And then, the moment your eyes open, it surges. Research in human circadian physiology has shown that cortisol levels jump between 38 and 75% within 30 to 45 minutes of waking. This event even has a name in the scientific literature. It is called the cortisol awakening response, and it represents one of the most significant hormonal shifts your body produces in any 24-hour period. Simultaneously, your adrenal glands push adrenaline into your bloodstream. Together, these 2 hormones do exactly what they are designed to do. They raise your heart rate, increase your blood pressure, and tighten your blood vessels slightly to push circulation toward your brain and muscles in preparation for activity. In someone younger with elastic, resilient arteries, that system performs smoothly. The pressure surge is absorbed, compensation happens quickly, and the body is simply ready for the day. But in adults over 60, 3 things have changed in ways that turn this same morning activation into something the cardiovascular system has to work much harder to manage. The first change is arterial stiffness. The elastic tissue in artery walls degrades naturally over time. A flexible artery acts like a spring, absorbing pressure waves and releasing them gradually. A stiff artery cannot buffer those same pressure waves. The surge that a younger cardiovascular system barely registers can produce a genuine and significant spike in someone whose vessels have lost that youthful elasticity. The second change is what may be sitting quietly inside those arterial walls. Many adults over 60 carry plaque deposits that have never caused a symptom, have never appeared on an annual screening, and have never triggered any alarm. But a sudden, sharp increase in arterial pressure can crack the surface of a vulnerable plaque deposit. When that surface ruptures, the body's clotting mechanism responds immediately and aggressively. The resulting clot in a coronary artery is a heart attack. A clot that breaks away and travels to the brain is a stroke. The plaque did not need to be large enough to block anything. It only needed to be fragile enough to crack under pressure. The third change involves the blood itself. After 6 to 8 hours without any fluid intake, you wake up in a state of meaningful dehydration. Your blood plasma volume is reduced. The blood is thicker and more viscous than it was when you fell asleep. And the proteins responsible for triggering clot formation are at their highest concentration of the entire day. Your cardiovascular system wakes up already primed toward clotting at the precise moment. It is also receiving a hormonal surge through stiffer-than-ideal pipes. And then comes the movement that compounds every single one of those factors simultaneously. Most people silence their alarm and within seconds sit straight up and swing their legs to the floor. It looks like nothing. It feels like nothing. It is one of the most ordinary gestures in daily life. But here is what it does to a cardiovascular system that is already in this vulnerable morning state. When you're lying flat, gravity is not a significant variable in how blood is distributed through your body. The heart pumps, blood circulates, things are relatively balanced. The moment you go vertical, especially quickly, a large volume of blood is immediately pulled downward by gravity. It pools in the veins of your legs and lower abdomen. The blood available to your brain drops rapidly. In a young and healthy cardiovascular system, a network of pressure sensors in the arterial walls detects this drop almost instantly and signals the heart to speed up and the vessels to constrict, restoring pressure to the brain within 2 or 3 seconds. In adults over 60, that reflex response is slower. The vessels take longer to respond, and before compensation catches up, blood pressure can drop 15, 20, sometimes 30 points within just a few seconds of standing. Many people over 60 know this feeling intimately. That gray, slightly dizzy, briefly unsteady moment that sometimes arrives when they first get up. Most have quietly filed it away as a normal part of aging. It is not normal aging. It has a medical name, orthostatic hypotension, defined as a drop of 20 millimeters of mercury or more in systolic pressure within 3 minutes of standing. Research suggests it affects somewhere between 20 and 30% of adults past 70. That is 1 in 4 or 5 people watching this right now, experiencing it every morning, not realizing what it is signaling about the load being placed on their heart. When blood pressure drops sharply upon standing, the heart receives an emergency signal to increase its output aggressively to restore circulation to the brain. That compensatory spike arrives on top of the cortisol surge, on top of the arterial stiffness, on top of the thickened morning blood. This is the convergence. This is why the research shows such a pronounced clustering of acute cardiac events in the early morning hours. Not because morning is vaguely dangerous, but because this very specific set of biological conditions is being triggered and then accelerated by a 25-second sequence of movement that almost nobody thinks twice about. Let me tell you about a man I will call Alistair. Alistair was 73 years old, a retired architect, meticulous about his health in the way that thoughtful, disciplined people tend to be. He monitored his blood pressure daily. He was on a statin and a low-dose beta blocker. His echocardiogram from the previous year had come back with no significant findings. His cardiologist had described his stress test results as encouraging. By any conventional clinical measurement, Alistair was doing the right things. He was managing his risk carefully and consistently. On an ordinary weekday morning, Alistair's alarm sounded. He reached over to silence it and sat straight up in one motion. He was in his kitchen within 4 minutes of waking. His wife came in shortly after and found him leaning against the counter, perspiring heavily, disoriented. He was taken by ambulance to the hospital within the hour. The event Alistair experienced was an acute coronary syndrome, a partial blockage caused by a plaque rupture and the clot that formed around it. He recovered, but when we sat together later and reconstructed that morning in sequence, every element mapped precisely onto the pattern. The immediate sit-up, the fast movement to the kitchen, morning blood viscosity, stiffened arterial walls, the compensatory blood pressure spike that cracked a plaque that had been sitting silently for years, never once announcing its presence. What stayed with Alistair, and what I suspect will stay with you, was not the medical detail. It was the simplicity of what had been missing. Nobody had ever told him that the first 60 seconds out of bed deserved the same attention he gave his medication schedule. Nobody had ever asked about his morning routine in any of his appointments. His clinical management was not wrong. It was appropriate and thorough. What it lacked was this specific knowledge that the transition from lying down to standing upright is its own distinct cardiovascular event, and that the way you move through those 25 seconds matters independently of everything else you're doing to protect your heart. Before Alistair was discharged, we discussed 4 simple changes to his morning. No equipment, no expense. At his 6-month review, his morning blood pressure readings showed a noticeably more stable pattern across the board. The dizziness he had experienced and dismissed for years was completely gone. He asked me a question I've heard more than once in that setting. Why had none of this ever come up before? The honest answer is that the body of research on morning cardiovascular risk exists primarily in specialty journals and conference presentations. The gap between what the science has established and what actually reaches a patient in a standard appointment is wide. Closing that gap, one piece of evidence at a time, is part of why I make these videos. There is one more layer to this that most people never hear about, and it has to do with breathing during sleep. A large proportion of older adults breathe through their mouths during at least part of the night, whether due to sleeping position, mild nasal congestion, or any degree of sleep disorder breathing. Mouth breathing accelerates overnight fluid loss significantly. Research has measured water loss through exhaled air as substantially higher in mouth breathers compared to nasal breathers. But even nasal breathing over a full night of sleep results in the body losing between half a liter and a full liter of fluid through respiration and passive perspiration, with zero intake to replace it. By the time the alarm sounds, your blood plasma volume is measurably reduced. Your blood is thicker. Your heart must generate more force per beat to push that thicker fluid through the same diameter vessels. This has been confirmed in circulation research going back decades. And layered on top of morning hormonal activation, arterial stiffness, and a postural blood pressure drop, the thickened blood represents yet another variable stacking pressure onto a system that is already under load. Clotting research adds a further dimension. A protein called PAI-1, which prevents the body from dissolving clots once they form, follows a predictable daily rhythm and peaks in the early morning hours, precisely within the same window when cardiac events are most concentrated. Platelet activity follows a similar pattern. The biology, viewed in full, presents a picture of a system that is simultaneously most vulnerable and most primed toward dangerous clotting in those first minutes of the day. The corrective for this particular factor is almost startlingly simple. A glass of room temperature water, not coffee, not juice, not anything cold, placed on a nightstand the night before and consumed before your feet ever touch the floor. Drinking before you are upright gives your system a small but meaningful volume of fluid before the gravitational shift begins. It starts reducing blood viscosity and diluting clotting factor concentration at the exact moment those things matter most. Research on morning hydration in older adults consistently shows measurable improvements in blood viscosity and platelet behavior when fluids are replaced promptly after waking. One glass does not fully restore overnight losses, but it begins the process before your heart is asked to manage everything else simultaneously. Now, bring all of this together into a morning sequence. 4 steps, 90 seconds to 2 minutes in total, no cost, no equipment, nothing to purchase. The first step begins the moment your alarm sounds. Do not move. Stay flat. Your cortisol surge is beginning, and the most effective thing you can do in the next 15 seconds is activate your body's calming nervous system branch before that wave peaks. Take 4 slow, deliberate breaths. Inhale through your nose for a count of 4. Hold for 1. Exhale through your mouth for a count of 6. The extended exhale is not incidental. It directly stimulates the vagus nerve, which is the primary channel through which your body applies a brake to a stress response. Research on controlled breathing in older adults has shown measurable reductions in systolic blood pressure response when slow breathing is performed immediately upon waking. 15 seconds. Flat on your back. 4 breaths. That is your first protection. The second step is the water. Before you sit up, while you're still reclined, reach for the glass on your nightstand and drink it. The timing matters. Once you're standing, the cardiovascular cascade is already fully engaged. Drinking before that transition provides a small but real buffer to your blood volume before your heart is working against gravity. Tonight, before you sleep, fill a glass of water and place it within reach of where you sleep. That one action, done this evening, changes tomorrow morning's cardiovascular risk profile before you even close your eyes. The third step is the transition itself, and this is where most people in that 25-second danger window make the critical error. Roll to your side first. Sitting straight up from flat creates a more abrupt pressure change than rolling sideways and pushing yourself up with your arms. From your side, press up to a seated position. Let your feet hang over the side of the bed. Then, before you stand, rotate your ankles slowly. 10 circles in each direction. This is not incidental movement. The calf muscles are the most powerful venous pump in your lower body. Contracting them actively pushes pooled blood back upward toward the heart, beginning to restore the circulation volume your brain is about to need when you go vertical. Research has documented ankle movements of this kind, reducing the blood pressure drop upon standing from a median of more than 17 millimeters of mercury down to approximately 1 millimeter in people with orthostatic hypotension. 30 seconds sitting at the edge of the bed, then stand slowly, pressing through your legs. Once upright, pause for 10 seconds before your first step. Your baroreceptors need that time to calibrate. You're giving your body the window it needs to manage the gravitational shift properly. The fourth step is simply awareness. As you sit at the edge of the bed, take a moment to notice how you feel. Any unfamiliar heaviness in the chest. Any shortness of breath that was not there when you fell asleep. Any pressure or discomfort that radiates. Any heart sensation that feels genuinely different from ordinary morning grogginess. Most mornings you will notice nothing worth flagging, and that becomes your reassuring baseline. But by building this brief check into your routine, you ensure that on the morning when something is different, you're already paying attention. You have not rushed past the signal on your way to the kitchen. If you're taking a beta blocker, which a significant number of adults over 60 are, there is an additional consideration worth understanding. Beta blockers work by reducing your heart's response to adrenaline. That is precisely what makes them effective for blood pressure and rhythm management. But that same mechanism also slows your heart's ability to compensate when blood pressure drops upon standing. Research on aging populations has found that beta blocker use was associated with substantially elevated odds of orthostatic hypotension compared to untreated individuals. This is not a reason to question your prescription. These medications are prescribed for important reasons, and they protect lives. But it means the graduated transition in step 3 is not optional for you. It is essential. Your heart's automatic compensatory response is being modulated by the medication. You need more time, not less, before you go fully upright. If you experience regular morning dizziness and you take a beta blocker, bring it up at your next appointment and ask specifically whether dosing timing is contributing to your morning symptoms. The morning is not randomly dangerous. It is specifically dangerous because of specific biological factors that converge in a narrow window and are then accelerated by a habit of movement so ordinary that almost no one questions it. A hormonal surge pressing against stiffer arterial walls. A postural pressure drop forcing the heart into emergency compensation. blood that is thicker and more prone to clotting than at any other point in the day. And the simple, unremarkable act of sitting up and standing immediately that pushes all three of those factors in a simultaneous peak load. For breaths flat on your back, a glass of water before your feet touch the floor, a slow roll to your side, 30 seconds sitting at the edge of the bed with your ankles moving, and a deliberate, unhurried rise to standing. 90 seconds. That is the investment. And for a heart that has been working without rest, without complaint, without a single day off for every year of your life, it is a very small thing to offer in return.